Hello students, in today's video we are going to talk about a very common problem, that is cold sores. In this video we will study what are cold sores, their cause, how do they spread, their symptoms and how do they heal. Now cold sores, also commonly known as fever blisters, are tiny, fluid filled, irritating, painful blisters that always appear in groups or in clusters, most commonly on the lips. Now these cold sores, they can also appear in areas around mouth or nose. Now the question arises, what causes cold sores? Now cold sores is a common viral infection. It's most commonly caused by herpes simplex virus 1, in short HSV1. Now cold sores are also popularly known as oral herpes or fever blisters or herpes labialis, as in most cases they appear on the lips. Now these cold sores heal on their own in about 2 to 3 weeks. Now how does the infection spreads? Now herpes simplex virus 1 is highly infectious and the virus spreads through direct contact or close contact with the infected person. Like for example, coming in contact with the infected saliva, then sharing infected articles like utensils, straws, lip balms, kissing, then oral sex with the infected person, or by coming in contact with the fluid in the blisters, lesions or wounds can also rapidly spread the disease. Now let's understand stages of cold sores, that is how the disease is manifested, its symptoms, what happens before the appearance of cold sores and how do they heal. Now first stage is the prodrome stage. Now this stage occurs before the appearance of blisters. Now 1 or 2 days before appearance of cold sore blisters, the affected site of the lip becomes red, swollen, painful. Then burning and tingling or prickling sensation and abnormal sensation is also felt in this area. Now other associated symptoms that can appear are sore throat, painful swallowing, headache, fever, muscle pain and swollen lymph nodes. Now as fever occurs before the appearance of cold sores, the disease is also known as fever blisters. Now after 1 to 2 days, blisters appear on the affected site and these blisters, they remain intact for around 2 days, and after that these blisters, they burst, they break or rupture and the fluid is released. Now these ruptured blisters with fluid oozing out of them are also known as weeping blisters. Now the affected area transforms into a reddish painful wound. Now this wound gradually develops a scab or a crust over it. Now as the wound heals, the crust becomes very hard. It dries up, cracks and fall off. And the affected area heals completely in around 2 to 3 weeks. So the viral infection is usually mild and it is self-limiting. It heals on its own in 2 to 3 weeks. Now another very important feature of this disease, now cold sore blisters appear either due to primary infection or due to secondary infection of herpes simplex virus. Now primary infection is when an individual gets first time infected with the virus. Now this usually occurs in the childhood and the cold sores or the blisters, they heal over a period of 10 to 20 days. Now very important, healing of the sores does not mean that the virus is eradicated from the body. Virus is not eradicated, but the virus becomes dormant and the virus resides in the dormant state in the nerves. Now this dormant virus does not produce cold sores unless and until it is reactivated. Now, this virus can remain dormant throughout the life of an individual. But if this dormant virus is reactivated, it again produces cold, sore, blisters, and now the infection is termed as secondary or recurrent infection. Now, this secondary infection can occur once, twice, or several times depending upon the patient and situation. Now, very important, there are certain triggering factors that activate the dormant virus. Now, some of the triggering factors are immunosuppression, then emotional stress of the individual, injury, then hormonal changes, exposure to heat, chemotherapy, radiotherapy, etc. Now, these triggering factors activate the dormant virus, and the cold sores, they reappear. Now, let's study complications of cold sores. Now, cold sores are usually mild, but they can cause complications. Now, if infection from the cold sore blisters spreads to the eye, then it can cause herpetic keratoconjunctivitis. If not treated, this can result in blindness. Now, if the infection reach brain, it can cause encephalitis. Now, even though the cold sores, they heal without treatment, but treatment with anti-herpes virus drugs play a very important role in the management of cold sores. Now, topical treatment, that is medication or the creams to be applied directly on the affected area, and oral anti-herpes virus drugs are prescribed by the physician. Now, treatment of the cold sores speeds up the process of recovery. The cold sores, they heal fast. It also reduces chances of secondary infection or reoccurrence. And besides this, treatment of cold sores effectively prevents or reduces complication. Now, treatment should be done only in consultation with a physician. Another very important thing you should know here is this, that the herpes simplex virus is of two types: herpes simplex virus 1 and herpes simplex virus 2. Now, as discussed, herpes simplex virus 1 commonly causes cold sores. Now, herpes simplex virus 2 commonly causes genital sores. Now, in this video, we have restricted our discussion to cold sores. Now, please note that the information given in this video is only for informative purpose to create awareness regarding the cold sores. For treatment, consult your physician. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.